I am here today along with you to tell you as a frontline emergency room physician in Toronto that these cuts to public health by the Doug Ford government and by Minister of Health Christine Elliott must stop at this time. I am here to tell you something that you already know, that the people of Ontario in our emergency rooms are already suffering tremendously. In the past 1 week, at one of the hospitals that I work with in the GTA, there were 12 patients who had been waiting more than 2 days in the emergency room for a hospital bed. The sad reality is by cutting public health funding in the City of Toronto and the province of Ontario, this reality is only going to continue. The truth is that the public health service of the province of Ontario keeps our water and our food safe, and this keeps patients out of the emergency room. The truth is that the public health units in this province prevent new cases of diabetes, and that prevents patients from coming to the emergency room. The public health units of this province alert doctors and other health professionals when important infections are on the rise. This includes measles, influenza, SARS, syphilis, gonorrhea, Lyme disease. Public health helps me do my job as an emergency room physician, take care of patients, and I am grateful to public health as an ER doctor. And let me remind you, my friends, this is 2019, and as an emergency room physician and as a society, we are facing one of the greatest challenges we have ever faced before. And as was said, that is the opioid crisis. In 2018, 294 people in this city died because of an opioid overdose. In 2019, this year, 144 people have died because of an opioid overdose. But it is because of the efforts of our public health units in this city and across this province that we are seeing harm reduction programs, needle exchange programs, helping these people's lives be saved and keeping them out of the emergency room. I also want to remind all of you, as you know, that tobacco smoking has a huge impact on the health of Ontarians. Because of the efforts in smoking cessation by Ontario public health units, there are less cases of COPD or chronic obstructive pulmonary disease and lung cancer, and this keeps patients out of the ER. I want to tell you that there is no worse time in this province's history than at this time to cut public health funding. I want to say that the actions of the Doug Ford government have not been unnoticed by professionals like ourselves. In fact, with me, I have a letter to Minister Christine Elliott and Premier Doug Ford from 133 emergency room doctors and professionals saying the cuts have to stop. I want to close these remarks by showing you a powerful symbol of what we could do together. This, my friends, this is a stethoscope. It's a symbol of what we can do together as healthcare professionals, as paramedics, as public health units, and as doctors. But the doctor's stethoscope is not powerful without the mighty arm of public health. And so, my message to you, Doug Ford, my message to you, Christine Elliott, if you can hear me up the street at Queen's Park, is that these cuts must stop for the people of Ontario.